What exactly does a nurse do? Your answer probably depends on the experiences that you have had in the past. Most people think a nurse is someone who gives a shot at the doctor's office, or simply is a doctor's assistant. Furthermore, images of nurses in the media also paint a different picture of who a nurse really is. However, a nurse has a number of roles that he or she performs, often at the same time, depending on a patient's needs. With all of the changes in healthcare over the last few decades, that role has expanded even more. Let's explore a few of these roles. As a caregiver, a nurse provides hands-on care to patients in a variety of settings. This includes physical needs, which can range from total care, doing everything for someone, to helping a patient with illness prevention. The nurse maintains a patient's dignity while providing knowledgeable, skilled care. In addition, nurses care holistically for a patient. Holistic care emphasizes that the whole person is greater than the sum of their parts. This means that nurses also address psychosocial, developmental, cultural, and spiritual needs. The role of caregiver includes all of the tasks and skills that we associate with nursing care, but also includes the other elements that make up the whole person. Another role of the nurse, as a decision maker, is to use critical thinking skills to make decisions, set goals, and promote outcomes for a patient. These critical thinking skills include assessing the patient, identifying the problem, planning and implementing interventions, and evaluating the outcomes. A nurse uses clinical judgment, his or her ability to discern what is best for the patient, to determine the best course of action for the patient. As a communicator, the nurse understands that effective communication techniques can help improve the healthcare environment. Barriers to effective communication can inhibit the healing process. The nurse has to communicate effectively with the patient and family members, as well as other members of the healthcare team. In addition, the nurse is responsible for written communication, or patient charting, which is a key component to continuity of care. The nurse works with other healthcare workers as the manager of care and ensures that the patient's care is cohesive. The nurse directs and coordinates care by both professionals and non-professionals to confirm that a patient's goals are being met. The nurse is also responsible for continuity from the moment a patient enters the hospital setting to the time they are discharged home and beyond. This may even include overseeing home care instructions. For nurses in the hospital setting, the nurse is responsible for prioritizing and managing the care of multiple patients at the same time, which adds another dimension to this process. Being a patient advocate may be the most important of all nursing roles. As a patient advocate, the nurse's responsibility is to protect a patient's rights. When a person is sick, they are unable to act as they might when they are well. The nurse acts on the patient's behalf and supports their decisions, standing up for his or her best interests at all times. This can empower a patient while recognizing that a patient's values supersede the healthcare providers. As a teacher, nurses help patients learn about their health, medications, treatments, and procedures, as well as deal with challenges they may face during and after their illness. Patients often have questions and might be confused about all that is happening to them. As a teacher, the nurse may also need to instruct family members about how they can help a patient. In addition, discharge instructions, or instructions about what to do once they are not in a hospital setting, are important so that a patient can easily care for themselves at home. Now that we have discussed these roles, let's look at a patient example of how these roles are illustrated. Mr. Jones was playing basketball and fell on the court. He broke his right hand and will have surgery tomorrow. The nurse comes in and gives him pain medicine, checks his hand for swelling, and offers him something to eat. She is his caregiver. Next, she sees that his swollen hand is dangling off the bed. She uses critical thinking skills to place a pillow under his arm to support it, which will reduce swelling. She is a decision maker. While doing these things, she is a communicator, as she speaks with him in an empathetic, supportive tone. She sets up an occupational therapist to work with him at home, as he is right-handed and will need help with his computer work. She is his manager of care. Mr. Jones asks her not to wake him up at night, as he is very tired and wants to sleep. As his patient advocate, the nurse stands up for his wishes and communicates with the rest of the healthcare team. Finally, as his teacher, the nurse explains to him what to expect before and after surgery, as well as the directions for his pain medication at home. As you can see, a nurse wears many hats, and the role has many aspects that make it a rewarding, challenging, and complex profession. In summary, as a caregiver, a nurse provides hands-on care to patients. This includes holistic care, which emphasizes the whole person is greater than the sum of their parts, including a patient's psychosocial, developmental, cultural, and spiritual needs. As decision maker, nurses use critical thinking skills to make decisions, set goals, and promote outcomes for a patient. As a communicator, the nurse has to communicate effectively with the patient and family members, as well as other members of the healthcare team. As a patient advocate, the nurse's responsibility is to protect a patient's rights, act on the patient's behalf, and support their decisions. Finally, as teacher, nurses help patients learn about their health, medications, treatments, and procedures, as well as deal with challenges they may face during and after their illness.
What motivates us to be as healthy, strong, and active as we can be? Is it intrinsic forces, extrinsic forces, or both that pushes us to make good choices about our lifestyles? My guess is you don't know the answer to that, nor do I, because it's always changing. What matters is that whatever the motivating factor is for people, they have to harness it and use it to continue going in the right direction. As nurses, it is our job to help our patients find their inspiration and what their driving factor will be to put them on the path to better health. One tool that nurses can use to help guide their patients in the right direction is the health continuum, also called the illness-wellness continuum. The illness-wellness continuum is an illustration that draws a connection between the treatment paradigm and the wellness paradigm. Where they meet in the middle is considered the neutral point. Some examples of the continuum include the 6 components of personal health. These are categories within each of our daily lives that must be balanced in order to attain optimal health. This is a great tool that nurses can use to help their patients visualize, plan, and achieve their goals for a healthier lifestyle. Consider the farther down the continuum your patients go towards illness, the closer they are to death. Rather, the farther up the continuum your patients go towards wellness, the closer they are to optimal health. Nurses are not only responsible for treating their patients, but educating them on how prevention and lifestyle choices can help them move towards health and wellness. The continuum can be visualized many different ways, but here are a few examples. The illness-wellness continuum was first imagined by Dr. John W. Travis in 1972. In this illustration, you can see that the wellness paradigm spans the entire length of the continuum, since this is the direction our patients must be facing in order to achieve high-level wellness. The treatment paradigm, however, only leads patients to the neutral point, or in other words, a non-illness state. Our goal as nurses should be to move our patients beyond that, to a more optimal level of health. As you can see from the illustration, the way to achieve this is through awareness, education, and individual growth. In this illustration, you can see that not only is the health continuum moving from optimum wellness to premature death, with the various stages in between, but the 6 components of personal health are surrounding the continuum as well. The components are revolving around the continuum and contingent upon each other in a continuous state. The 6 components of personal health consist of physical health, is our body functioning as well as it could be? Emotional health, can we express ourselves adequately? Mental health, does stress consume us or can we cope when needed? Social health, do our friends and family help us or hinder us? Environmental health, is our air, water, and food clean and safe? And spiritual health, are we following our own code of ethics, morals, and values? All of these factors affect which direction our patients go on the illness-wellness continuum. These states are not fixed, and even the slightest of changes can make a difference to their overall health. Let's look more closely at each of the 6 components of personal health. Physical health. Unfortunately, as hard as we try to eliminate the causative agents of various disease processes, we can't be 100% immune unless we live in a bubble. We can, however, give our bodies a fighting chance through prevention methods such as hand washing, immunizations, health screenings, and proper diet and exercise. Factors that we have no control over, yet have an enormous impact on our physical health, are our age and genetics. As hard as we may try to stop or reverse the hands of time, it is inevitable. Likewise, we have no control over our genetic makeup. Emotional health. Being able to adequately express feelings in a constructive way, while difficult, can be very enlightening to not only ourselves but to those around us as well. It's unrealistic to imagine a life with no conflict, but it is realistic to imagine a life where feelings can be addressed in a way that is the least damaging to all those involved. Mental health. Much like our physical health, we cannot control all aspects of our lives that can impact our mental health. Demands of our daily lives can change from one minute to the next, so the key is how we manage those demands and how we cope when we can't. When faced with a stressful situation, do we deal with it head-on? Do we sit back and let it play out? Or does it depend? Social health. While for the most part we get to choose our friends, that is not the case with family. Our friends and family are our main sources of support in times of need. The quality of those relationships and the meaningfulness behind them is what makes or breaks them. We want our sources of support to empower us and guide us along any path we may choose. If we find ourselves in relationships that are discouraging, we must ask ourselves why, and either alter those relationships or terminate them. Environmental health. Many issues can affect one's environment, and since we have already come to conclusions that we can't live in a bubble, we have to do our best to maintain today's standards of sanitation and safety with regards to our environment, food, and water. Chemical and radiological terrorism, along with many other environmental exposures such as lead, can be extremely harmful and are continuously being monitored by the National Center for Environmental Health. Finally, spiritual health. No matter the God or higher power, if we choose any, it is expected that we follow our internal compass in regards to what is right and what is wrong. Being connected spiritually to another person, place, or thing can give us direction and a sense of harmony. Visualizing the health continuum allows our patients to set goals for themselves to ensure a healthier lifestyle by becoming more educated and aware of what is needed to reach high levels of wellness. As nurses, just showing patients the continuum and describing it is not enough. Specific plans that are tailored to each individual patient are important. For example, consider a patient who is struggling with obesity and other health conditions related to this, such as high blood pressure or diabetes. This places them within the treatment paradigm. You can show them that they have the ability to move past the neutral point into the wellness paradigm by working with them to decide on a realistic and motivating weight loss regimen and an exercise plan that will give them direction and purpose versus just wishful thinking. Helping them to analyze their own 6 components of personal health and what they mean to their overall well-being is another tool nurses can use to show their patients where improvements are needed within their everyday life. Nurses are the front-line educators for their patients, and it is their job to keep patients on the path of wellness. As the old saying goes, practice what we preach. Therefore, it's important that we ourselves stay on the right side of the continuum. The health continuum is an excellent visual resource for nurses to use when educating their patients about their overall health now and where it has the potential to go in the future. Although there are numerous examples of the continuum, some use the 6 components of personal health as an adjunct to the continuum. Each of the 6 components are important separately but come together as a cohesive unit when optimal wellness is achieved.
Yikes! Homeostasis. What does that mean? Because it sounds pretty complicated. Well, it's actually quite a simple concept once it's broken down. The not so simple part is how we maintain homeostasis. Now that's a process. The Merriam-Webster Dictionary has a few different definitions of homeostasis, but we are going to focus on the 2 that are straight from the medical dictionary. Let's start with the first one. Homeostasis is the maintenance of relatively stable internal physiological conditions, such as body temperature or the pH of blood, in higher animals under fluctuating environmental conditions. Okay, kind of complicated. The second definition of homeostasis is the process of maintaining a stable psychological state in the individual under varying psychological pressures or stable social conditions in a group under varying social, environmental, or political factors. This may be a little easier to understand, but it's still pretty complicated. Okay, the bottom line is homeo means same, and stasis means stable. So in other words, our minds and bodies work best when they remain the same and stable. But how often does that really work? Probably not as often as we would like. So what can affect homeostasis in our mind and bodies? The answer is stress. Negative stress is something that can cause strain or tension either physically or mentally in our daily lives. It's impossible to define specific negative stressors because everyone experiences things differently and responds differently to them. What causes a great deal of stress for one simply slides off another. While one feels more emotional pressure, others might feel more of a physical strain and find themselves feeling ill during periods of chronic negative stress. Regardless of how it affects us, the overall process of homeostasis is disrupted, so we become unbalanced. Let's take Lena, for example. Lena is a registered nurse in a busy emergency room. She deals with life and death situations regularly at work without missing a beat. She finds that if she doesn't take time out occasionally for herself by exercising and spending time with her family and friends, she is not quite as effective as she would like to be. But she thinks it's really nothing to worry about. One day, however, she receives a phone call at work to find out that her father has had a stroke. Initially, Lena takes it in stride and tells herself everything will be fine. After 3 months of physical therapy in a long-term care unit, Lena decides that her father will have to come and live with her and her family so she can help care for him on a daily basis. She underestimated just how demanding this would be, and she begins to notice that she is not sleeping as well. One day at work, she unintentionally makes a critical mistake and gives a patient the wrong medication. It becomes obvious that although Lena can manage a great deal of stress in her life, at this point she's taken on too much. She decides she needs help to care for her father and hires an agency that provides home visits to take care of her father 4 times a week. With this small amount of extra time, Lena makes self-care a priority and begins exercising regularly, adding in meditation and massages occasionally. After a short time, Lena begins to feel more like herself and finds that she responds to the stress in a more productive way. She begins to have a better relationship with her father and family, and is regaining her confidence at work as well. Now let's take a look at Laura. Laura is a personal trainer and a yoga instructor. She maintains a 100% organic diet and is very environmentally conscious. Her clients rely on her to help them maintain their own healthy lifestyle, so it is important that Laura set a good example for them in her own day-to-day life. The reason Laura began practicing yoga was to help her clear her mind. She often found herself worrying about things in her life that she had no control over, yet couldn't keep herself from being anxious about. One day, a client told her that they could no longer afford her services and they would be leaving. Laura instantly began to worry that she had done something wrong and that the client was not satisfied with her and that is why they were leaving. She found herself reflecting on every interaction they had had in their time together and started questioning some of her tactics. Her anxiety began to become obvious to some of her other clients, and they in turn began questioning her strategy. Although she counsels her clients about healthy lifestyle practices, she has to remind herself daily that her thoughts and fears impact her own lifestyle in a negative way. If Laura worries too much, she notices that her immune system becomes run down as well, and she often ends up not feeling well or being able to see her clients. Laura knows what is required of her in order to preserve homeostasis, but it's hard for her to not let her anxiety take control of her. It ends up becoming a cycle that Laura has to break in order to maintain homeostasis. She found that in order to do that, she can use solution-focused coping, meaning take control of your life where you can. Instead of focusing all her energy on things that she can't change, she focuses in on the things she can, and improves upon those aspects of her life. Both women are very different in regards to their tolerance of stress, but the key for them is becoming aware of this and doing what they need to do to be their best. For some, stress is such a part of their everyday lives that they adapt easily to the demands placed on them. For others, stress is so non-existent that one slight change in their everyday lives easily tips the homeostasis scale in the wrong direction. One important question remains, though, is all stress bad? The answer is no. We need positive stress to thrive and excel at life. Positive stress provides a different kind of reaction in our minds and bodies that help to balance out the negative stress. Changes such as marriage, childbirth, or graduation can all cause stress, but in a good way. It gives us a sense of purpose and direction and motivates us to rise to the challenges that we face in our everyday lives. So now we know that homeostasis means same and stable. How we maintain homeostasis depends on who we are and how we handle the different stressors we are faced with. We know that not all stress is bad, and we do need positive stress in order to thrive and excel. Negative stress, on the other hand, can cause strain or tension, either physically or mentally. Lena and Laura were both good examples of two people in their everyday lives that can handle different levels of stress before their lives become dysfunctional. They each found their own ways of adapting through exercise, relaxation, or solution-focused coping by taking control of your life where you can. Life is a balancing act, and our amazing bodies adapt to so many different changes throughout our lifetime. Taking care of ourselves as a whole package, mind and body, is essential. Keeping it all in check is the key to homeostasis.
What is the nursing process? In nursing, this process is one of the foundations of practice. It offers a framework for thinking through problems and provides some organization to a nurse's critical thinking skills. It's important to point out that this process is flexible and not rigid. It is a tool to use in nursing care, but one that should allow for creativity and thinking outside of the box. Let's look a little more closely at the 5 steps. Here is an acronym to help you. ADPI, which stands for assessing, diagnosing, planning, implementing, and evaluating. For this lesson, we will be thinking of each part of the process as a slice of pie. All of the pieces added together give you the whole pie, or ADPI. The first step in the nursing process is assessing. In this phase, data is gathered about the patient, family, or community that the nurse is working with. Objective data, or data that can be collected through examination, is measurable. This includes things like vital signs or observable patient behaviors. Subjective data is gathered from patients as they talk about their needs, feelings, and perspectives about the problems they're having. In this step, information about the patient's response to their current situation is established. Let me introduce you to Mrs. Apple, and we will start with assessing. The nurse takes her blood pressure, pulse, and oxygenation level, which are abnormal. She also notes that Mrs. Apple is sweating and pale. These are examples of objective data. Mrs. Apple states, "I feel like an elephant is sitting on my chest, and I am scared." These are examples of subjective data. The second phase of the nursing process is diagnosing. The nurse takes the information from the assessment, analyzes the information, and identifies problems where patient outcomes can be improved through the use of nursing interventions. Nursing diagnoses are different from medical diagnoses because they address patient problems that result from the disease process, while medical diagnoses focus on the disease process alone. The nurse takes the information he gathered during the assessment of Mrs. Apple and makes a list of her current problems. These include pain and fear, among others. This moves us to the third phase of the nursing process, planning. The nurse prioritizes which diagnoses need to be focused on. The patient can and should be involved in this process. Planning starts with identifying patient goals. Goals are statements of what needs to be accomplished and stem from the diagnoses. Both short and long-term goals should be established. Next, the nurse plans the steps needed to reach those goals, and an individualized plan with related nursing interventions is created. Let's go back to Mrs. Apple. The nurse, along with Apple, sets goals for her pain management and plans steps to take. Although the nurse recognizes that Mrs. Apple is afraid, she prioritizes the pain first, knowing that addressing her pain may make her anxiety lessen. Professional nurses use the first 3 steps of the nursing process in order to provide excellent, thoughtful, and purposeful nursing care. If we skipped straight to step 4, the things that are best for the patient may not occur. The fourth phase of the nursing process, implementing, occurs when the nursing interventions or plan are actually carried out. Common nursing interventions include pain management, preventing complications following surgery, teaching and educating patients, and procedures that are part of nursing care. In our scenario with Mrs. Apple, the nurse offers pain medication, teaches deep breathing and relaxation techniques, darkens the room, and plays soft music for her. The final phase of the nursing process is called evaluating. Here, the nurse measures the patient's progress toward the goals that were established in the planning phase. Keep in mind that as the nurse carries out the planned interventions, he or she is constantly reassessing the patient, modifying diagnoses, and adding to the care plan along the way as needed. This evaluation may show that the patient's goals have been met and the problem is resolved, or it may indicate a need for change. If a patient is not responding to the plan of care, then the nurse has a responsibility to change the plan or even terminate it and start again. Remember, the goal is improved patient outcomes. After about 20 minutes, the nurse checks on Mrs. Apple. She is resting quietly and reports, "I feel so much better now. My pain is gone." At this time, the nurse records Mrs. Apple's response and moves on to another diagnosis that he had discovered earlier in the assessment process. The cycle begins again. Let's summarize the nursing process and the steps involved. The use of the nursing process is a patient-centered framework, or steps in which a nurse uses critical thinking skills to solve problems. The acronym ADPI offers a great reminder of the phases of the nursing process. Assessing occurs when objective and subjective data is gathered about the patient. Diagnosing, the second step, is where the nurse takes the information from the assessment, analyzes the information, and identifies problems where patient outcomes can be improved through the use of nursing interventions. Third, planning is when the nurse identifies patient goals, plans the steps needed to reach those goals, and creates an individualized plan with related nursing interventions. Next, implementing is when nursing interventions are carried out. Finally, evaluating measures the patient's progress towards the goals and stays with the plan, changes it, or terminates it. In another lesson, we looked at the steps of the nursing process: assessing, diagnosing, planning, implementing, and evaluating. Goal setting occurs in the third phase of the process, planning. Because goal setting is so pivotal to nursing interventions and the plan of care, let's explore how to develop goal statements for nursing. Is our goal for nursing care to heal patients? To help them get better? To help them get well? While these are certainly in the forefront of our minds, how do you evaluate these statements? What if the definition of wellness is different from one person to another? This is why nursing goal statements that are patient-centered and measurable are so important. Before we get into the specifics of nursing goals, let's discuss goal criteria in general. One way to help you remember how to write goals is to make sure they are SMART. SMART goals are specific, measurable, action-oriented, realistic, and timely. Specific refers to who, what, when, where, and why. Measurable means that you can actually measure and evaluate the progress of that goal in a concrete way. Action-oriented means there are actions that can be taken to reach the goal. Realistic includes the ability to work on the goal, having the resources, attitudes, abilities, and skills to reach this goal, and how realistic it is to coming to fruition. Finally, timely means that there is an end time frame or date at which the goal is going to be evaluated. Let's look at one general example of a goal statement that a lot of us are familiar with: weight loss. Here is a common goal: I am going to try hard to lose some weight. Now, let's make this goal SMART. I will lose 10 pounds over the next month by exercising 3 times per week for 30 minutes and keeping a food diary each day. Why is this goal SMART? It is specific. The goal is 10 pounds. It is measurable. We can measure the actual weight loss at the end, and we can evaluate the number of times to the gym. It is realistic. 10 pounds over a month is not unreasonable, although a challenge perhaps. Finally, the time frame is included as 1 month. At this time, we could review the plan and see if the goal was met or unmet. Let's discuss how to apply this strategy to nursing. The purpose of goal setting in nursing is to provide direction for planning nursing interventions, serve as criteria for evaluating patient progress, enable the patient and nurse to determine when the problem has been resolved, and help motivate the patient and the nurse by providing a sense of achievement. Both short and long-term goals can and should be included in a nursing care plan. Short-term goals are often used in acute care settings, like hospitals. Here, most nursing care is focused on the patient's immediate needs. Long-term goals are important for home care in addition to longer stay facilities like nursing homes, extended care facilities, and rehab centers. When developing goals for patients, the nurse needs to look at several factors. Think back to the SMART goal criteria. In order to be specific, nurses focus on questions like: what is the problem? What is the response desired? To make it measurable, how will the client look or behave if the healthy response is achieved? What can I see, hear, measure, observe? Considering action-oriented, are there steps in nursing interventions needed to reach that goal? Is this a realistic outcome for the patient? Have we considered all of the factors involved, including the client's capabilities and limitations? Does the patient have what he or she needs to reach that goal? And finally, Is it timely? When do we expect the goal to be reached? Here are some examples of vague goal statements one might see in nursing. Increase patient hydration. Reduce pain and the patient will feel better. Patient should be able to breathe deeper soon. Let's rewrite those to make them smart. Here are some examples of excellent nursing goals. The patient will drink 100 milliliters of water every hour for the 12-hour daytime shift. The patient will report a pain level of 2 on a scale of 1 to 10 within 30 minutes of receiving pain medication. The patient will demonstrate the use of correct breathing and coughing techniques after instruction and repeat action every 2 hours during an 8-hour shift. Can you see how, by incorporating the criteria, these goals give structure and purpose to nursing care? Here are some tips for writing goals. Always start with the patient will, not what the nurse hopes to accomplish. Setting realistic goals can also decrease frustration and discouragement. In addition, the nurse should make sure to evaluate the goal statements in the time frame set up and revise as needed. As we have discussed, even though our goals for our patients are for them to heal, feel better, and get well, these goals are difficult to measure and evaluate. It is much clearer to organize a care plan and empowers the patient to see the progress and achievement of their wellness and health. Let's review how to write a nursing goal statement and the purpose of nursing goals. First, the goal needs to be specific. What is the response desired? Specific refers to who, what, when, where, and why. Measurable means that you can actually measure and evaluate the progress of that goal in a concrete way. How will the client look or behave if the healthy response is achieved? What can I see, hear, measure, observe? Action-oriented means there are actions that can be taken to reach the goal. Are there nursing interventions needed to reach that goal? Realistic includes the ability to work on the goal, having the resources, attitudes, abilities, and skills to reach this goal. Is this a realistic outcome for the patient, considering all of the factors involved, including the client's capabilities and limitations? Finally, timely means that there is an end date at which the goal is going to be evaluated. When do we expect the goal to be reached? Finally, the purpose of goal setting is to provide direction for planning nursing interventions, serve as criteria for evaluating patient progress, enable the patient and nurse to determine when the problem has been resolved, and help motivate the patient and nurse by providing a sense of achievement.
Let's say you love to cook. One day you come up with a great new way to make spaghetti sauce. You add all the right spices in all the right amounts, and the result is delicious. But let's say you forgot to write down the recipe. Without a record of how you made your fabulous sauce, you'll never be able to make it again. Just like a cook needs to keep detailed records about ingredients, a nurse needs to keep detailed records of patients. Record keeping is the act of organizing and documenting information relevant to a patient's treatment. Good patient records include well-documented details about patient care and the patient's response to that care. In this lesson, you'll learn why proper record keeping is important and principles that must be followed to ensure proper record keeping. A patient record is a permanent documentation of a patient's care by a healthcare provider. While it might feel as if a nurse is interrupting treatment to write down notes, patient records are vitally important to the continuing care of a patient. Consider this. A nurse may encounter 20 different patients in a day. It's impossible to remember details about each of these patient encounters. Nurses must learn the principles of good record keeping because these records serve as a history of client care, reveal patterns in a patient's progress, guide future care decisions, support financial billing, and may even be used as evidence if legal issues arise. Do you remember when we talked about the importance of writing down the recipe for your delicious spaghetti sauce? Well, let's say you did remember to write down the ingredients. However, the next time you pulled out the recipe, it was so full of eraser marks, confusing abbreviations, and illegible writing that you couldn't follow it. Like a recipe, a patient's records must be complete and written clearly to be useful. There are general principles that nurses must follow to ensure the records do their job. Records should be written as soon as possible after a patient encounter. This quick action makes it more likely that important details aren't forgotten. Of course, taking notes ASAP doesn't mean they should be rushed. Take enough time to ensure that all notes are recorded neatly. Patient records must be clear and legible. If you're not happy with the clarity of a note you make, remember that records should never be altered or destroyed without proper authority. If you do something wrong, don't erase mistakes. Instead, draw a line through the mistake and then sign and date the correction. The records need to include notes on care that was given, any problems that arose, and actions taken to deal with the problems. You should also document if a patient refuses a treatment. For example, a patient complains that the medication they were given on the last visit made them feel nauseated, and they don't wish to continue that treatment. The nurse should record the medication and patient complaint to alert the doctor and guide future prescriptions. While it may feel tedious, each patient record needs to include the date, time, and a signature. These elements help develop a timeline for patient progress and could prove vital if the patient notes are needed in a legal case. It also helps to use standard terminology and abbreviations, so there's no confusion amongst professionals that might need to review a patient's records. You want to avoid vague statements that are open to interpretation. For example, if you write down that the patient seems better, you need to explain what made you come to this conclusion. Explain any evidence you notice that supports this view, such as the patient was talkative and answered questions coherently. And keep in mind that patient records are confidential. Therefore, nurses must maintain the records as confidential to protect the patient's privacy and rights. Never leave patient records where they might be viewed by unauthorized eyes. Let's review. Record keeping is the act of organizing and documenting information relevant to a patient's treatment. A patient record is a permanent documentation of a patient's care by a healthcare provider. These records serve as a history of client care, reveal patterns in a patient's progress, guide future care decisions, support financial billing, and may be used as evidence if legal issues arise. Principles of recording include the following. Records should be written as soon as possible after a patient encounter, must be clear and legible, and should never be altered or destroyed without proper authority. If you do something wrong, don't erase mistakes. Instead, draw a line through the mistake and then sign and date the correction. The records need to include notes on care that was given, any problems that arose, and actions taken to deal with the problems. Document if a patient refuses a treatment. Include the date, time, and a signature. Use standard terminology and abbreviations, and avoid vague statements that are open to interpretation. Nurses must maintain their records as confidential.
You're arguing with a friend, coworker, or significant other and getting nowhere. The argument keeps going in circles with no end and no solution. Can you picture it? Have you been in a similar situation? Ask yourself, could part of the problem be we just aren't communicating? Both effective and ineffective communication can influence us, not only in our everyday lives and relationships, but in our careers as well. In the high-stakes situations that nurses often deal with, awareness of our communication can be especially beneficial. There is a lot of information about the different types of communication, but there are only two main forms, verbal and nonverbal. In 2011, N. Naab writes, "Verbal communication entails the use of words in delivering the intended message. However, there are two different modes of verbal communication, oral and written, so no matter how the verbal message is being conveyed, it will either be written or spoken. On the other hand, nonverbal communication is defined as communicating by sending and receiving wordless messages. Body language, like facial expressions, eye contact, posture, or gestures, are all examples of nonverbal communication." This lesson will focus on the two types of verbal communication and how they are related to nursing and healthcare in general. With so many people involved in healthcare, it can be overwhelming for patients and families. Nurses often find themselves as the one that connects all the pieces of the puzzle. Nurses play a pivotal role in the process of effective communication, whether they're exchanging information with physicians, reporting off to other shift nurses, or educating patients and their families. Communicating is a continuous process when working in the healthcare industry. Oral communication is extremely important for all those involved, including nurses. Not only do nurses relay relevant information to patients and their family, they are also responsible for updating the physician about the condition of their patients on a regular basis. Nurse-to-nurse reporting occurs whenever there is a change in assigned duties, at the end of a shift, or if a patient is transferring to a different level of care. This communication is a fundamental part of the nursing process, and can result in either high-quality, effective, or ineffective care caused by lack of information. Imagine a busy emergency room where a patient comes in from a motor vehicle accident in critical condition. It is the physician's duty to be the team leader and to designate what needs to be done to his or her individual team members in a confident and efficient manner. If the team leader orders a drug stat, such as epinephrine, without clearly stating the dosage or route, the nurse will have to assume the quantity and method of delivery. Do you see a problem here? Perhaps the nurse miscalculates and gives the patient an ineffective dose. As far as the team is concerned, they believe it was the correct dose since nothing was verbalized. With the patient non-responsive, they're forced to move on to the next step of resuscitation, when in fact the correct dose would have been effective. It is up to the physician to clearly state their orders, not only for everyone to follow, but so that the orders may be repeated back as another measure of accuracy. This type of oral communication is also crucial for the nurse who is recording in order to have an accurate written documentation. Whether an institution is using handwritten nursing notes or electronic medical records, written documentation is permanent and legally binding. Written communication between all parties, including the doctors, nurses, patients, and patient families, can occur in a number of forms. The key to all written communication is that it is clear and accurate. Using correct terminology ensures that other medical professionals can care for patients without errors. It also ensures that all those involved clearly understand the plan of care. For example, a physician writes for the following orders: bedside glucose PCHS and 0200. What this means is that the nurse is to check the patient's blood sugar after meals, before bed, and at 2 a.m. Common practice is to check a patient's blood sugar before meals, not after. This written communication by the physician was not accurate and becomes questionable to the nurse treating the patient. The nurse's job is not to interrogate the physician, but rather to confirm the orders in a professional manner so that the patient receives appropriate quality care. In this case, both accurate written and appropriate oral communication are necessary for successful communication to occur. Effective communication is a very important concept for nurses and all those involved in healthcare. Quality care simply cannot exist without it. We talked about the two main forms of communication, verbal and nonverbal. Verbal communication is the use of words to deliver the intended message, and nonverbal communication is the use of wordless messages, such as body language or facial expressions. Focusing on the verbal form of communication, we broke it down even further into oral and written communication, so the messages will be either written or spoken. For nurses, the information they pass along to physicians, patients, and other nurses needs to be clear and accurate. As we saw in the emergency room example, ineffective oral communication from the team leader led to an incorrect dosage and prevented other team members from catching the mistake. Repeating orders back to the physician to verify accuracy is an example of effective oral communication. Written documentation is considered legal evidence and can be used in a court of law. Therefore, it is just as important that the information in written documentation be clear and accurate. The purpose and practice of good communication for nurses is twofold. Not only does it ensure proper care, but it also protects all those involved. Wouldn't it be great if we never had to make difficult decisions? If we never had to deal with controversy or advocate for what's right in the face of hostility? Unfortunately, the nursing profession is not immune to these kinds of situations, and there will come a time in any nursing career where a path needs to be chosen. Following the Code of Ethics for Nurses will help you choose the right one. The American Nurses Association 2014 states, "The Code of Ethics for Nurses was developed as a guide for carrying out nursing responsibilities in a manner consistent with quality in nursing care and the ethical obligations of the profession." After years of revising, the initial Code for Nurses was developed in 1985. The American Nurses Association House of Delegates accepted the final draft in June 2001, which included 9 provisions and was termed the Code of Ethics for Nurses. When working in the service industry, a code of ethics is a fundamental document that, in essence, is an agreement between those being served and those who are serving. It also provides direction and assistance when the right decision isn't always obvious. In a profession where the stakes are high, tough decisions will inevitably be made at some point, and this is where it gets tricky. Our lives are interchanging, and our professional ethics are not the same as our personal ethics, and at times may conflict. Our personal code of ethics, or our conscience, drives us to be our best in our private lives, while our professional ethics drive us to be our best in our careers. But which one wins out when we have to abandon one or the other? As nurses, the answer may not always be clear, so let's take a closer look at the 9 provisions set forth by the American Nurses Association. Provision 1. The nurse, in all professional relationships, practices with compassion and respect for the inherent dignity, worth, and uniqueness of every individual, unrestricted by considerations of social or economic status, personal attributes, or the nature of health problems. For example, nurses caring for the elderly or the disabled need to offer the same level of care as they would to a newborn baby or mother of 3. Provision 2. The nurse's primary commitment is to the patient, whether an individual, family, group, or community. In situations where an extended family is adamant about a loved one's care and their ideas differ from the actual patient, as long as the patient is competent, their wishes are the nurse's command. Provision 3. The nurse promotes, advocates for, and strives to protect the health, safety, and rights of the patient. There may come a time when a nurse may disagree with another care provider, including a physician. Whether right or wrong, it is the nurse's duty to advocate for their patient, even if it is difficult for them to challenge another colleague, especially an authority figure. However, this must be done tastefully and with respect to all those involved. Provision 4. The nurse is responsible and accountable for individual nursing practice and determines the appropriate delegation of tasks consistent with the nurse's obligation to provide optimum patient care. Some tasks are required to be delegated to other team members, such as the nurse's aide, so there needs to be a high level of trust and respect between the two parties, because the ultimate responsibility still remains that of the registered nurse. Provision 5. The nurse owes the same duties to self as to others, including the responsibility to preserve integrity and safety, to maintain competence, and to continue personal and professional growth. Shifts, especially those lasting between 12 and 13 hours, are grueling and will eventually take their toll on the health and wellness of nurses. Taking care of their own mind and bodies is essential and will in turn improve the care they provide their patients. Provision 6. The nurse participates in establishing, maintaining, and improving healthcare environments and conditions of employment conducive to the provision of quality healthcare and consistent with the values of the profession through individual and collective action. A chaotic environment, or one that is not supportive, cannot possibly result in high-quality healthcare. It is not only the nursing administration's duty to promote a positive environment, it is every healthcare professional's duty to support and respect one another and in turn work as an effective team in providing quality care. Provision 7. The nurse participates in the advancement of the profession through contributions to practice, education, administration, and knowledge development. A nurse is an educator, and in order to do that, they must maintain a level of awareness and expertise about evidence-based and best practice. Whether continuing their education with certificates that enhance their knowledge in their specific areas of nursing, or being awarded an advanced degree in nursing, they are bettering their practice for themselves and their patients. Provision 8. The nurse collaborates with other health professionals and the public in promoting community, national, and international efforts to meet health needs. Working as an active part of the team is an essential quality that all nurses must possess, whether that team is colleagues or community members. Many nurses volunteer their services abroad as well, working to immunize and teach those less fortunate how to care for themselves and their loved ones. Provision 9. The profession of nursing, as represented by associations and their members, is responsible for articulating nursing values, for maintaining the integrity of the profession and its practice, and for shaping social policy. Nurses are the authority in their field and need to be leaders in regards to upholding a level of professionalism and determining what best practice is. The American Nurses Association is an excellent example of this through its promotion of nursing as a profession now and in the future. Using the approved Code of Ethics for Nurses written by the American Nurses Association will give any nurse a strong ethical platform in which to make hard decisions in their own practices. Different situations will apply to different provisions, each one representing a different set of challenges, but all equally important. Maintaining a code of ethics will show those who are receiving care that the profession of nursing is held to a high standard that all nurses are required to follow every day.
What do you think of when you hear the word intervention? You might have heard the term used in regards to efforts made to help those with drug and/or alcohol problems. You may also be familiar with it as a television program. While that is a commonly used meaning of the word, in the nursing world, it has a broader meaning. When nurses care for patients, they follow the nursing process. This includes making a plan and setting goals for the patient. Nursing interventions are the actual treatments and actions that are performed to help the patient to reach the goals that are set for them. The nurse uses his or her knowledge, experience, and critical thinking skills to decide which interventions will help the patient the most. There are different classifications of nursing interventions that can involve care of the entire patient. This can be anything from promoting bowel functioning, educating the patient on new medication side effects, or just keeping the patient safe. Interventions can be focused on basic physiological needs, complex physiological needs, behavioral functioning, promoting safety, caring for the family, using the health system, and/or the overall health of the community. As nurses, we are caring for the total patient, so there can be interventions concerning every area of the patient's life. To get a sense of how interventions work, let's take the case of an imaginary patient, Mrs. James. Mrs. James has recently been admitted into the hospital. She is a 72-year-old female with a blood pressure reading of 200/100. She is complaining of a headache and dizziness. We are going to learn some of the nursing interventions that we could provide while caring for Mrs. James. Now, let's see how different types of nursing interventions might be applied to Mrs. James. Some of the nursing interventions will require a doctor's order, and some will not. There are different types of interventions: independent, dependent, and interdependent. Let's learn about each and go over a few examples. Independent. These are actions that the nurse is able to initiate independently. The following would be an example of a health promotion nursing intervention, which is an independent nursing action. Mrs. James has started a new medication for her high blood pressure. She is concerned about the side effects and is refusing to take the medication. The nurse intervenes by educating the patient on the purpose of the medication, the side effects of the medication, and the possible consequences of high blood pressure. Dependent. These interventions will require an order from another healthcare provider, such as a physician. Mrs. James' blood pressure is consistently 180/100. The nurse reports this to the physician. The physician orders an antihypertensive medication for the patient. The nurse administers the oral medication to the patient as ordered. Interdependent. These are going to require the participation of multiple members of the healthcare team. Mrs. James reveals to the nurse that she consumes a diet very high in sodium. The nurse includes diet counseling in the patient care plan. To help the patient even more, the nurse enlists the help of the dietitian that is available in their facility to spend time with Mrs. James to educate her on the role that diet plays in the control of high blood pressure. So how does the nurse know what to do? How do they know which interventions to select? Nurses must use their knowledge, experience, resources, research of evidence-based practice, the counsel of others, and critical thinking skills to decide which nursing interventions would best benefit a specific patient. Nursing care plan books and computer programs are available that include generic nursing interventions for different problems and diagnoses. But these must then be individualized to specific patients and adapted to their situation. So, did the intervention work? Did we meet the goal? Once the intervention is performed, it must then be evaluated to see if it was successful in obtaining the goal we had for the patient. Interventions can be revised if needed once they are evaluated. After educating Mrs. James on the need for her antihypertensive medication, Mrs. James decides to take her medication. Therefore, the independent nursing intervention of health promotion regarding her medications was effective. It is vital that nurses are familiar with nursing interventions. Many times these are part of written or computerized care plans decided in advance, but sometimes they are interventions that must be done in the moment as events occur. It is essential that the nurse be prepared through education and experience to provide the best nursing care for each patient. The examples of nursing interventions are limitless. They are what we do to care for our patients, to give them the quality of care that they deserve. Nursing interventions are the actual treatments and actions that are performed to help the patient to reach the goals that are set for them. The nurse uses his or her knowledge, experience, and critical thinking skills to decide which interventions will help the patient the most. There are different types of interventions: independent, dependent, and interdependent. After a nurse uses education and experience to select an intervention, an evaluation must be performed to determine whether or not the intervention was a success.